What are you supposed to do if you see a person experiencing cardiac arrest? What about someone choking while eating a meal? Or a near-drowning incident? If you've watched any dramatization by movies and TV, you'd have seen an actor attempting chest compressions or giving their version of a rescue breath. While that is not inherently wrong, it tends to downplay how crucial fast and structured management is for a patient's outcome. What these adaptations do try to portray is the emergency protocol that we will be discussing in our third episode of our Basic Professional Toolkit series. In this video, we will be discussing basic life support. In a nutshell, BLS is the type of care that first responders like healthcare providers and public safety professionals provide to any individual who is experiencing cardiac arrest, respiratory distress, or an obstructed airway. BLS is typically performed on these victims of life-threatening situations until more comprehensive care can be given by advanced life support personnel. You're driving down the road and come upon an accident. You're walking down a path in the park and find someone lying face down in the grass. Someone suddenly keels over and is unresponsive. How do you determine if that individual needs CPR? Breathing and pulse are the two key factors in determining if someone needs CPR or not. But there are also other signs to know if someone needs an immediate CPR. So here are a few things to observe. Number 1. Sudden collapse. In this case, you need to check for the breathing and the pulse. Number 2. Unconsciousness. If the person is unconscious, try to wake the person first. If unresponsive, then check the breathing and the pulse. Number 3. Breathing problems. If there's no breathing or limited breathing, this may call for CPR. Number 4. No pulse. No pulse means the heart may have stopped. Number 5. Electrocution injuries. If you witnessed an electrical injury, do not touch the victim. Instead, try to kill the power source or remove the victim from the electrical contact, and make sure to use something that does not conduct electricity. Number 6. Drowning, drugs, exposure to smoke or inhalants. This might call for a combination of rescue and breathing and chest compressions. Practitioners performing the BLS protocol take either a primary or a secondary survey of the patient, depending on the severity. To put it simply, a primary survey means using non-invasive techniques to assess a patient, while a secondary survey requires invasive techniques before you transfer them to higher care. These surveys evaluate patients via the ABCs of the BLS, which correspond to the 3 vital components of emergency care: airway, breathing, and circulation. A is for airway, wherein the patient's airways, such as the nose and windpipe, must be unobstructed at all times. When performing the BLS protocol, always assess if the patient would need any advanced airway if the patient's chest ceases to rise during breaths. B is for breathing. Practitioners must always assess the ventilation of the patient, administering adequate amounts of oxygen to his or her airways. This can be done either through a special mask or through an inserted tube. C is for circulation. Practitioners must assess the delivery of blood throughout the patient's body, evaluate their pulse and its rhythm while maintaining a steady blood pressure. If needed, give intravenous rhythm-based medicines by inserting an IV line. Since we are in the time of the pandemic, it is important to put on full PPE, which consists of an N95 mask, goggles, face shield, gown, double gloves, hair cap, and booties. If your patient does not have a mask, then place a mask on them. Upon seeing an unconscious victim, we must ensure the safety of the place or scene. Next, we need to check if the patient is responsive by tapping the patient on his or her shoulders while saying, "Hey, are you okay?" If the patient is unresponsive, we need to call for help by alerting other members of the rescue team that there is an unresponsive patient. Checking of pulse and breathing then follows. If the patient has no pulse and is not breathing or is only gasping, we must start CPR and hook the patient to a defibrillator or AED. With this, we should start the timer for proper documentation upon reaching the hospital. If the rhythm is shockable, we must alert all rescuers that we are about to give one shock. All rescuers must then keep all hands away from the patient as the shock is being delivered and resume CPR immediately for 2 minutes. If the rhythm is not shockable, we should resume CPR for 2 minutes or until the ALS provider can take over or the victim starts to move. During CPR, ensure quality CPR by giving it at a rate of 100 to 120 per minute and at least 2 inches in depth, and allow the chest to return to normal after each compression. We also need to plan actions and give oxygen to the patient. In some situations, it is wise to consider advanced airway and capnography. Continuous chest compressions must also be given when advanced airway is in place. Vascular access must also be done. Epinephrine is also given at 1 mg per IV every 3 to 5 minutes. And lastly, identify and correct reversible causes. It is also important to note that shockable rhythms must be defibrillated immediately. Early return on spontaneous circulation may preclude the need for airway and ventilatory support. Also, avoid giving rescue breaths and bag mask ventilation. If already on a mechanical ventilator, just do continuous chest compressions while on the ventilator. But if the patient is not on a mechanical ventilator, do hands-only CPR and consider early intubation, then hook to a mechanical ventilator. After resuscitation, remove the PPE as per the donning and doffing instructions. Throw away all the disposable equipments and disinfect or sterilize other equipments. All waste should be double-bagged and taken to the COVID-19 bin by a porter. We often see medical doctors use an automated external defibrillator or AED. We also usually see these located not just in the hospitals, but also in other buildings. So, what does this machine do and how does it save lives? Automated external defibrillators are used to help those experiencing sudden cardiac arrest. It can analyze the heart's rhythm and can deliver an electric shock or defibrillation to help the heart re-establish an effective rhythm. Did you know that sudden cardiac arrest is among the leading causes of death? And because of this, it is important to learn how to use an AED, because the only way to restore a regular heart rhythm during cardiac arrest is through an AED. Now, let's see how you understand BLS. You can pause the video while you try to answer the following questions. Question number 1. While performing high-quality CPR on an adult, what action should you ensure is being accomplished? Question number 2. What should you do if you need to use an AED on someone who has been submerged in water? Question number 3. How can rescuers ensure that they are providing effective breaths when using a bag mask device? Question number 4. What is a consideration when you are using an AED? And question number 5. Which victim requires high-quality CPR? Here are the current guidelines or algorithms for BLS for your reference. And that's all for the episode of Basic Life Support. We hope this video helped you recognize emergency cases and be able to respond immediately. See you in our next video in our Basic Professional Toolkit series.